answer is very simple. There is a conjunctival bleed, pinpoint bleed. Very simple. But don't be in a hurry to announce the result. Always try to make maximum out of a picture or any other clinical finding. What all important areas are there in and around here? You need to check all these areas so that something else may add on to this clinical finding which will help in the diagnosis. What are obvious in this picture? You can have clues from the conjunctiva, you can have clues from the sclera, you can have clues from the eyelids and the skin around. And next to that, you can plan, I'll check the lens and the fundus in this context is so relevant. And I can have a plan in the general examination, what all things to be looked for in the general examination and in the which system I am going to examine. So first situation, you check the conjunctiva, and this is a case where the conjunctiva is pale. So conjunctival bleed plus pallor, your diagnostic possibility is most likely malignancy, leukemia, lymphoma, any other malignancy also, bone marrow invasion producing bicytopenia or pancytopenia. The second possibility is connective tissue disorders, vasculitis, can have hemolysis, cytopenia, and sometimes iridocyclitis. And in that situation will be conjunctival congestion, but the suppression of the bone marrow lysis is possible in a case of connective tissue disorders also, but not that common. Now another situation, the conjunctiva is congested. So what comes to your mind? Most common one is the infections. We are all aware of the dengue situation, conjunctival congested and petechial bleeds are there. The conjunctival congestion can be bulbar or conjunctival. Bulbar is scleral conjunctival in congestion. So that can occur in certain conditions. Episcleritis and connective tissue disorders are more likely if it's a scleral type of conjunctival congestion. And infections, most important one is dengue. Other infections also like Legionella, the rickettsial disorders, chlamydia, mycoplasma and all produces conjunctival congestion, but the thrombocytopenia is not that common as in a case of dengue. And the third situation, the eyes are congested at the same time, red, yellow also, jaundiced and petechia. So what is the commonest important condition? Leptospira. Here, very important, whenever there is an yellowish eye, you need to check around the eyes because there can be a situation of some hematoma tracking onto the eyes to produce bilirubin local production. So this can occur due to head injury or hematoma or neurosurgical procedures or even hemorrhagic conjunctivitis or ophthalmological surgery and all can mislead you. There can be a bleed, there can be a jaundice that can represent the just a local pathology rather than being a generalized disorder. So this is a situation where the eyes are hematoma. So another situation in the eyelids, there can be puffy eyelids. The puffy eyelids with the conjunctival bleed means there can be another reason for edema also. It can be a renal disorder, there can be sometimes platelet affected. The classical one is the hemolytic uremic syndrome in a child where renal failure is there, thrombocytopenia is there. Other renal disorders also, especially SLE and this leptospira, all can produce renal function problem and eyelids can be puffy. Here it is a bleeding. So now in that context you have an idea what next. In the eye you need to check for the lens cataract, case of Wilson's disease and all, always it's a must to see the fundus, because any bleeding, the decision making is based on your fundal bleeds and you are worried about the intracranial bleed. So fundus always to be checked. And what all things in the general examination? Of course, there are many things, out of which vital signs shock is the most important one. Then other things, pallor, of course, you have seen. Other rashes, any other types of bleeding you need to check in the other parts. It can be ecchymosis like this. In this case, ecchymosis is any rash may argue for a connective tissue disorder or an infection. And other types of bleed, you need to check. What is important is lymph nodes. So rash, lymph nodes, other types of bleedings, joints, many other clues can be there, fever can be there, all in the general examination. Which are the systemic findings? Most important system definitely is a GIT, and your important is liver and the spleen, and of course other systems also are important. We'll not be going in detail about the investigation of such a case. Thank you.